Hey guys, so now we're going to look at a lumbar x-ray or a lower back picture. So in this case, we're looking at this lady from behind. So this is her left hip, that's the right hip, and then obviously you can see the zipper and the buttons from the pants and the underwire from the bra. Probably should have had that taken off, but we don't gown people historically. And then the little black spots you see are just basically air. So it looks as if you look at the angle of her pelvis, it looks as if her pelvis is doing this. In reality, it's doing this. So the pelvis looks like it's tilted, but it's actually posterior on the right-hand side and anterior on the left-hand side. So it's basically stuck in a pattern like that. And then you notice the spine leans to the right and then curves back to the left. So what the body will do when the pelvis is stuck in that position, the spine will lean toward the posterior hip, lean toward one side, and then the body will correct itself to get back over your center of gravity. Your body's not going to let you walk around like that. It's going to straighten you to get you back over your center of gravity. So that's what we're dealing with here. And if you take a cross section of that part of the body, when the spine moves or shifts enough out of position, it'll irritate or compress or damage the nerves that start in the lower back, and they travel to the back and the hips and down into the legs, but it's also the same nerves that are controlling the bowels and the bladder and the reproductive system. Your brain is sending messages down the spinal cord and out the nerves into all those organ cells and tissues, and it can create issues with that as well. So part of the rehab, so we adjust them very specifically to get the right hip back anterior, left hip posterior, so we can balance out the lower part of the spine or the foundation. And then we show them stretching exercises. We use a wedge that goes under the right hip to retrain the soft tissues to hold that new position. So if this looks like you, if you got back pain, sciatic issues, or even some digestive issues, and you want more information, feel free to reach out, and we'd love to see you soon.